Good afternoon. This is Keeping It Real with V and G. And today we have two excellent guests. We have Miss Marcella Nettles, who's going to talk with us about open enrollment and a wonderful, wonderful exercise program, especially for seniors, Matter of Balance. We also will have Miss Yolanda Long, who is our resident RN, and she's coming back to give us an update on what's going on in the healthcare field and all of that. So we want you to sit back, get comfortable, and be ready to listen. We are going to be imparting quite a bit of knowledge today. My first guest is Miss Marcella Nettles, and she's with the Area Agency on Aging. She is going to talk with you about open enrollment, and she's going to ask a special favor in relations to matter of balance. I'm not going to take any time on her introduction because she's a regular. She's been on here before, and we'll probably have her again before open enrollment has concluded. So we will stop now and we will allow you to hear from Miss Marcella Nettles.
Good afternoon, everybody. I want to thank you all for having me today, and hopefully, my information will go over with you and you'll remember how to contact us. I am the community coordinator for South Alabama Regional Planning Commission, the Area Agency on Aging. And at this time of year, October 15th through December 7th, there we have Medicare open enrollment for Medicare recipients. The program we work under is called the SHIP program, which is the State Health Insurance Assistance Program. It is a federal program that is monitored by the state and the local area agency on aging. In this program, we help people to see what their benefits are or to understand their benefits. If you're new to Medicare, we walk you through every step of the way to get you in the right plan for yourself. Or if you're retiring and in your company plan, we explain to you what benefits you have and how that works with Medicare. We also do senior RX program for people that need help with their medicines and they don't qualify for any low income programs, and we can kind of walk you through that as well. We also are not seeing people at this time, but we do make phone appointments or we can do over the screen internet appointments, and you can email me as well. Our main telephone numbers are 251-433-6541. Our Aging and Disability Resource Center, which take applications on folks that need help, and they can tell you what benefits you qualify for. And their number is 251-706-4680. We also have a 1 800 number, which is 1 800 243 5463. Any of those numbers, you can reach us and we can help you with any solutions that you have for Medicare, any problems that you have, any questions that you have that we can go over. We walk you through every step. Our counties are Baldwin, Escambia, and Mobile counties, but there are 13 SHIP programs all over the state of Alabama, and they do pretty much the same things that we do. If you're wanting to help somebody in another county, if you can call us and we'll give you the number to that county. But I want to go over today some of the things SHIP can do for you. We can help you understand your Medicare benefits. We can determine which Medicare prescription drug plan is best for your needs. We can answer any questions about Medigap policies and other health insurance programs for seniors. SHIP can also assist with Medicare beneficiaries in specific areas such as home health benefits, Medicare claims and appeals, and other similar issues. SHIP can give you details about benefits available in your area and refer you to other helpful programs. We're always glad to talk to you. If anything you need or any Medicare solutions you need help with, you can call us. We also do fraud cases where if you're having trouble with, if it's Medicare related, you can report that to us and we report it to our a local agency and they will contact you about the fraud event that happened. Um, SHIP is a plan comparison program where we compare our plans, whatever is best for you by putting in your meds, billing and claims, any billing issues that you have that's related to Medicare. We can go over that with you. Sometimes it's just a misunderstanding of the coding of the hospitals or um, anything relating to your bill, we can go over with you, try to help you understand what the problem is. You have these rights, and we want to help you implement them by giving us a call. It's a trusted company, it's a federal company, and we are not favored toward any one plans, any insurance companies. We're strictly for helping you decide what's best for you. Um, I'm now going to talk about our Manner of Balance program. That's a program that is a wonderful class. It's 8 weeks. It's 1 day a week. We get you healthy and moving in that class. It's usually for people that have had falls, and you don't have to have had a fall, but we kind of keep you aware of what's going on, maybe at your home or your medications, anything that help you get better with any type falls you have. Um, our exercises are low impact exercises. I think the majority of them are sitting. We do have a few that are standing, and that's only if you're able to stand. The class is for seniors that are 60 years old and older. We have classes at different churches and different organizations, senior centers, and we usually, when we get ready to have a class, we publicize it on our website. You're welcome to be a part of those classes, and we are definitely looking for instructors in that class. If you feel like you're a great teacher and motivated to keep the seniors motivated, then give me a call. And my number is 251 706 4663. We also have in our Senior RX program, if you need help with medications and you're not on any low income programs already, we can try to help you get a particular med. Our Senior RX program is handled by James Roberson is the director, and he'll be implementing those programs as he go out in the community and talk about too as well. We're also looking for volunteers. Um, we'll be glad to have you. However many hours you want to volunteer with us, you're welcome. Um, we don't put pressure on you. If you're retired, we understand that. We work around your schedule. So just please give us a call and let us know if you'd like to volunteer. I can't think of any other questions that we may have. We do have in our Medicare program, the SHIP program, if we feel like you may qualify for extra help, which is a program through Social Security. It depends on your income. And if you get approved, that will make your medicines low. That would help with your cost of your medicines. And then there's a program called QMB through Medicaid that pay for the 148.50 that comes out for Part B. And you can give us a call for that. We're now taking appointment applications. Just give us a call. We'll set up an appointment time for you to call us and we can talk with you. We have several certified trainers that can help you with questions regarding your Medicare. If you have any questions, don't feel like you can't call us. If we've helped you through and you need to call us again, it's okay. That's what we do all day long. Answer any questions that you have, help you figure out what to do. If it's a caregiver, you can call us for help. Usually, siblings and children that are taking care of a parent and they don't know what to do or where to go, you can always call us. And I want to thank you for having me today. And I hope you take in this information and pass it on to somebody if you can't use it. But give us a call for any questions. Thank you.
Now, we do have a few questions.
Okay.
Okay. First of all, give us the dates again for open enrollment and give us again your contact information.
Okay. Open enrollment is October 15th through December 7th every year. My contact number is 251-706-4663. My email is mnettles@sarpc.org.
What happens if a person misses that open enrollment period?
Usually there's a waiting period until it all depends on your income, whether or not you're low income. Low income folks can sign up at any time, but people that are not, they give them that waiting period to go ahead and get changes to their policy, or we look at to see if they need something new, but they have to call during open enrollment time.
Okay. Okay. One of the things that we have noticed a lot of, because right now,
Mm-hmm.
the television is just flooded with all of these commercials for sign up for this, sign up for
Uh-huh.
that kind of thing. What exactly would you say is the difference between the Advantage, Medicare Advantage, and then regular Medicare?
Regular Medicare is just your parts A and B, and you have to have a drug plan. If you're going to keep just your A and B, you have to have a drug plan or else you will get penalized. The Part C is the Advantage plans. These plans have a contract with the government, Medicare, to handle clients that are in our area in every state. And Part C pay just like Medicare. Medicare pays 80% of your bill, and that leaves you 20% to pay. But there are supplements plans. You've heard of Medigap or
Yeah.
supplements. Those are plans that only pick up the 20%. Um, and that leaves you no bill when you can travel with it anywhere. It just depends on the person and the circumstances. And a lot of people that get the Advantage plans, they usually cannot afford the supplement plan. It just depends on the person, their personal situation.
Okay. All
Hmm.
right. Now, you did mention something. You talked about matter of balance
Hmm.
and you talked about needing volunteers.
Hmm.
How do you handle your volunteers? I mean, will I just be in a classroom and
Well, what I do, I have them come in and we talk to them. At least I talk to them about um, if it's usually a person maybe that has taught some kind of class, or and you don't have to. Some people are just naturals.
yeah,
They come in. I usually will interview them and find out what they like, and they feel like they can handle seniors.
yeah,
Then that's a fit for me. We'll try you, and I train them.
yeah,
Um, we do your first class. I'll usually go and sit in, and you're never alone. You always have a partner with you. We have to have two people in a class. And at the end of the eighth class, they're awarded a small gift and a certificate.
yeah,
Hmm.
good, good, quite a wonderful incentive.
Hmm.
Um, with your program, I know you talked a lot about Medicare. What about a person who has some questions about Medicaid?
Medicaid,
Mhm.
if it isn't pertaining to their Medicare, then we usually refer them to the local Medicaid office, which is on Dolphin Street, and we have a relationship with them.
Yes.
So usually, but they are in our Aging and Disability Resource Department. Most of those young ladies, they know what's what if the situation is pertaining to something that our agency handles.
Okay.
So,
Okay. Now, while you were talking, I took a few notes, but I missed the QMB. Will you
okay.
talk a little bit about that for us?
QMB is a program that it pays for the 148.50, and I don't have the income limits with me, but you can call my office and I'll give them to you. But that program pays for the 148.50. Every state in the United States is given so much money to handle their people in their state that are low income or meet the needs for this program to pay their 148.50. And they're welcome to call us for that. I can tell you if you're going to qualify, and if I feel like you do qualify or your income meets the qualifications, then we send you an application in the mail. You also can pick up one at the local Medicaid office, which is on Dolphin Street.
Okay, great,
Mhm.
great. All right. I know you talked about two or three things that the agency provides, but we know that that agency provides a whole lot of more
Mhm.
uh, programs. Will
We-
you talk a little bit about,
Okay.
how, where, what agency it is and what particular target population they serve?
Okay. Our ombudsman program, that's Mr. Frank Willis. That program is, he's under the state. And what he does, he's like a representative for um, the person that is in a nursing facility or assistant living facility that may need help and maybe have some problems with the facility in bathing or mistreatment, that kind of thing. And then that's when Frank go out and make an assessment of that particular incident. You can call us to make a formal complaint about it. The young ladies in Aging and Disability Resource Center will take that complaint and pass it on to him, and he then investigates whether or not what the problem is. So, hmm
Okay, good, good. All right. And the particular target age group is, what's the age group?
well, for we usually start it. Some things like they'll take at 55. That's when the medicine help.
Yeah.
That's 55 and older.
Okay.
But most of our programs are 60 and above.
Okay.
Uh-huh. Then
Okay.
we have our big senior expo every year.
Yeah.
It's usually in October. We didn't have one because of COVID last year. I don't know if we'll have one this year. It may be next year before they have one, but it's usually full of information. We suggest everybody to try and come. The seniors enjoy it. They have entertainment for them. They feed them. And then there's so many other agencies that are there
Yeah.
where they can get information. Any
Oh,
other questions?
okay. All
Uh,
right. Well, we certainly do appreciate you coming and spending this time with us and reviewing some of this information. It's been a little while since you've been back. So we're going to look at maybe you coming back, if possible, in December
okay.
before your deadline is up. So
Okay.
hopefully we can help get that word out so people who need the service will know how to contact you.
Oh, yes.
Okay. We do appreciate that's Miss Marcella Nettles, and we will also have that information on our Facebook page
Okay.
so that people will know how to contact you.
Okay.
Okay?
Thank you again.
We thank you.
Hmm.
Thank you, and we appreciate you taking that time with us today.
Okay.
Okay? Ladies and gentlemen, we're going to shift to our next presenter. As I said before, Miss Yolanda Long, who is our resident RN, and she keeps us up to date on the medical issues that are in and around Mobile and the nation as well. So we're about ready for Miss Yolanda Long, RN, and soon to be working on that doctorate degree. So maybe it won't be too much longer. We'll have to refer to her as Dr. Long. Okay. So let us now have Miss Yolanda Long. She's another one I am not going to spend any time introducing because she's a regular and she's with us every month. So you guys know her. Miss,
Good afternoon. I'm glad to be here. And I just want to thank Miss Nettles for her information on balance. And I was going to start out with COVID, but her presentation was very timely. Um, November, we're going into November, and that's going to be National Mental Health Month. And the balance and exercise not only helps with your quality of life because most older adults or anybody when you fall and you're not able to move, that decreases your quality of life, but especially older adults, they are more afraid to walk, they just stop walking. So balance is
That's
very
right.
important, and that exercise that she's talking about, it not only helps with balance, it helps with mood, those dopamine receptors. It's just like exercising, and that was excellent. It just fell right into place with what I wanted to talk about. And we, as a population, whether we realize it not or not, we have experienced some PTSD uh, related to COVID. You may not have noticed it, others may notice it in you, but it's some level of depression, of anxiety, mental health issues going on related to COVID. So we need to keep that in mind. And like she was saying, we want to be able to do for ourselves as long as we can. We want to increase our exercise. We want to increase our mental capacity. And that goes along with circulation, oxygen, um, developing, keeping that brain functioning and intact. We don't need to be isolated. We're not made to be isolated. We understand we had to isolate ourselves during COVID, but the more you interact with people, isolation doesn't mean just staying away from people. You can isolate yourself emotionally, physically, socially. So what we want to do is interact. We just like we're on this video today. That's interaction. We need to be stimulated by other humans. So that's one thing I wanted to talk about. Uh, November is also Alzheimer's month. So it's very important to exercise, keep moving, do some brain puzzles, keep your mind in top tip shape. So another thing we need to look at is COPD. We often talk about diseases, illnesses, and processes that affect African Americans, but COPD, Alzheimer's, and mental health issues crosses all socioeconomic lines. Diabetes is recognized in the month of November. We need to make sure we know what our levels are. We A1C, regular blood glucose level. If you're diabetic, make sure you're checking it, checking your blood glucose levels as prescribed by your doctor. Make sure you're getting your feet inspected. Make sure you're seeing a podiatrist. Make sure you're taking your medications as prescribed. Um, we we want you to live a long and healthy life. And like I was saying, I want your quality of life to be at the optimal level that it can be. Um, Lung cancer, we are more aware of lung cancer during the aware of the month of November because it's all over. You're going to start seeing more um, commercials related to smoking cessation. Pancreatic and stomach cancers are also an issue, and we'll get more information on that during the month of November. You may notice your healthcare providers start talking about it a lot, and they usually, whatever month it is, they'll focus on that, or they may send out little blasts or blurbs. I get information from my primary care physician all the time related to different disease processes that are that we're being aware of in that month. Um, I want to also tell you all about it's flu season. I need you to get your vaccinations. We didn't have that many flu cases of flu last year because we were wearing masks. Please, and you can get your flu vaccination and your COVID vaccination in the same day. They can be given in the same arm for people that are not able to get that vaccination because of maybe a shot because they are on dialysis and they can't have any sticks or blood pressure in a particular arm. You can get it the same day. So you can knock that out. And another issue I would like to talk about is the pneumonia vaccination. Children 2 years old and younger, and those 65 years old and older, and those with diseases such as diabetes, kidney disease, um, and those type things, any chronic illnesses, they should get it no matter what their age is. But I don't know if you all are aware or not, but those that are 50 years old or older should get the pneumonia vaccination. And I thank Ms. Nettles for taking me on into my healthy tips. But I'm going to get back to what I came to do. I came to speak to you all about COVID. And at this moment, like we always do, we're going to take a moment of silence for those affected and those that have died related to COVID. Okay, worldwide, there has been 247 million cases, and of those cases, 5 million deaths, over 5 million deaths. Nationally, in the United States, we've had 45.9 million cases with 745,000 deaths. Just wrap your mind around that number. We know not all people who receive the vaccination will survive, but I would much rather increase my survival rate. I really would. Um, 221 221,467% of the population has had at least the first dose in the United States. Those fully vaccinated is 192.2 million. That's 57.9% of the total population. And boosters, we have 17.7 million people in the United States, which is equivalent to 85.2% that have had the first and second vaccination along with their boosters. In the state of Alabama, we have had 11,621 cases. The deaths, and that's in this last month. The deaths have been 166, and the new hospitalizations over the last 7 days is 49.43 is the average for the week. The total cases for the state of Alabama is 832,000, and we've had 15,000 deaths. Just wrap your mind around that. That's a lot of people. In Mobile County, we have had 72,000 981 people diagnosed with COVID. We've had 1,350 people die of COVID in the state of Alabama. Guys, COVID is not gone. It is real. I'm not going to say the facilities that I go into, but I'm pretty sure if you pass around these local hospitals, and some of them have areas outside of their emergency rooms, the various emergency rooms, where you can see people with their lawn chairs that are waiting on visiting hours for their family members, and they go up and see them and they come back down and they sit with the family and wait and wait. COVID is not gone, it is still real. So it is very real. So, what I want you all to do, this is a little homework. If you have not been vaccinated, get vaccinated. Continue to wash your hands, continue social distancing. And I want you to become aware and educated on COVID because there's still misinformation. Also, I want you all to continue wearing those masks. I know a lot of places are telling people you can toss the mask. Protect yourself, protect your family, protect each other. And that's all I have for you all this week. You all have a blessed week. Thank you.
Want to thank you, Miss Young, for keeping us abreast of what's going on and what particular ailments are spotlighted for this month, the month of November, which we will be moving into tomorrow. And of course, we thank you for all of the information on COVID. And as she said before, and continues to say, we need to wear our mask. I am seeing, just like Miss Yolanda, I am seeing lots of people not wearing the mask and they're in and out of public places. But for your own benefit, keep the mask on. Um,
I would like to say one thing, if I could. I'm sorry to interrupt you.
no, that's okay.
I am looking forward to those that are 5 years old to 11 years old because of the emergency use for the Pfizer vaccination. I really feel that's going to be a game changer because so many parents are so concerned about sending their 5 to 11-year-olds to school and they have not been vaccinated. I'm really excited about it. I'm looking forward to it. And parents, if you have kids that are in that age range, please get them vaccinated. If you're afraid of the vaccination, please do your own research. There's a lot of misinformation. It's true, we don't know everything about the vaccination, but just like you get your kids vaccinated to go to school, it's certain things we're going to have to do to go to school and to stay in school. And I'm just encouraging you all to do that. And I won't interrupt anymore, but thank you.
That's fine. That's fine. We just appreciate it. And we do know, and I know you guys have seen it, but we did have our governor who decided that she was not going to adhere to the federal mandate for companies that have 100 plus employees to have a mask mandate and to also have the vaccinations. Now, whether or not legally she can do that, that's up in the air. I think it's more positioning than anything with her base. But for your benefit, as Miss Yolanda Long has reminded us constantly, month after month, it is much more safer for you to get the vaccine than not. Okay? We do want to thank both of our special people today. They have brought us a ton of information and have left us with a feeling of empowerment. You know, information is very powerful. And when you get the information, no one can necessarily take it away from you. So we do appreciate both of these ladies. And we're getting ready to end our show. We will be back next week, 4 o'clock. And I have to apologize because I was the reason why the crew was late. So, but anyway, we will be back next week, 4 o'clock, same place, same time, same channel. So please join us. We will have the president of Commonwealth Bank with us, and he's going to talk about the services they can provide and why it's important to bank black. So we will see you next week. And once again, thank you for joining us. Good evening.